There are 40% more deaths from cardiovascular disease than all cancers combined, right? So if you think about that epidemic, and when you think about sudden coronary death, like fatal heart attack, felt great one day, then went out for a run, never came back, the average age of that person is 50 years old in the US. It's 40 for firefighters. It's 40 in the Middle East. And so that means half the folks are coming in their 30s and 40s and dying from their first heart attack. You know, in the 1960s and 1970s, there was this stress test that was invented, right? That was to try to figure out whether or not somebody's symptoms were indicative of having that person having heart disease. And so the reason it's called a stress test is that we measure your heart at rest, and then we put your heart under some stress, like on a treadmill or on a bicycle, or give you a medicine, and then we compare like the baseline to the stress state to see whether or not there's differences and whether or not the patients are getting adequate blood flow to the heart muscle. It's an indirect marker of whether or not you might have a plaque in the arteries of your heart. And then if the stress test was positive, then what we do is we send you for this invasive angiogram where you look at whether or not the plaque caused a narrowing. So if you think about that, our tests, what they did was they measured indirect markers of the plaque that was building up in the heart artery walls, as Tony mentioned. But it never actually measured the disease itself, which is the plaque, or the atherosclerosis is what it's called.